The purpose of this video is to discuss two pulmonary devices, the compressed air jet nebulizer and the Easy Breathe Atomizer. Inhaling medicine from one of these devices is more similar to normal tidal breathing than inhaling medicine from either metered dose or dry powdered inhalers. As a result, these devices can be useful to give medications in situations when breath holding by metered dose and dry powdered inhalers can be challenging. Healthcare professionals who recommend therapy or teach patients about respiratory medicines should be knowledgeable about these devices. In this video, we will discuss jet nebulizers and the atomizer, including the parts of these devices and assembly for use, proper inhalation technique and troubleshooting these devices, cleaning, replacement, and storage of these devices in between use, and their advantages and limitations compared with other respiratory devices. Let's first review the nebulizer components. Compressed air-driven jet nebulizers are the most common for home use. Therefore, this is the type we will be demonstrating throughout this video. As a reminder, there are other types of nebulizers with special features that are largely confined to institutional use because of their expense. Each nebulizer may look a little different, but will have the same general components. A medication cup or reservoir is where the liquid medication will be placed. The nebulizer itself is usually in the top of the cup. Inside is a little dome or baffle. Either a mouthpiece or mask will be connected to the top of the cup. There's often a T-shaped tube from which the mist is exhaled. There is an air compressor which directs air through the medicine to form the mist. The thin plastic tubing connects the air compressor to the medication cup. Again, each brand of jet nebulizer is a little different, so the exact appearance and setup may vary slightly. Some newer jet nebulizers are actually much smaller and can fit in a purse or even the palm of your hand. Also, some medications are only approved to use for certain types of nebulizers. For example, Pulmicort, Respules, or budesonide is only approved for use with compressed air-driven jet nebulizers and not ultrasonic ones. Double check the medication's package insert if you have questions. Check the instructions of your nebulizer for the exact setup and if you have questions. So, how do nebulizers work? In the nebulization process, the liquid medicine is aerolized into a fine mist. The goal is to form small liquid droplets that are the right size to be inhaled and remain in the lungs, about 3 to 5 microns. The compressor forces air through the liquid medicine through a narrow opening at the bottom of the cup. Air turbulence forms the medication mist. The baffles also help break up the liquid into smaller droplets. Smaller droplets leave the nebulizer through the mouthpiece in a continuous mist. Larger droplets will hit the baffles, fall back into the cup, and are able to be renebulized. About 90% of the liquid medicine ultimately leaving the cup is renebulized at least once. The baffle also slows down the mist so that it can be inhaled into the lungs. If the mist came out too fast, the medicine mist would impact on the back of the throat and be swallowed. The patient inhales the medication mist and then exhales it out the back. The T-tube helps to decrease drug loss and increase the amount of drug inhaled. By acting as a reservoir, the T-tube holds the aerosol during the pre-inspiratory pause, allowing that medicine to be available at the beginning of the next inhalation. When the liquid in the cup falls below a certain level in the cup, a consistent spray cannot be formed. At this point, there is a subtle change in the sound. At this so-called sputtering point, drug delivery becomes inefficient and the treatment can be ended. This liquid left in the cup is sometimes called the dead volume. Depending on the nebulizer, the amount of medicine solution remaining in the cup can be as much as 0.5 to 2 milliliters.